Okay, thank you, Njoki, and good evening, everyone. I'd like to welcome you to this session, our session for this evening. It's about research, and we are glad to have Professor Wanyoro with us. He'll take us through the session. So Professor Wanyoro is one of our senior colleagues. He's an associate professor in obstetrics and gynecology at Kenyatta University and a senior obstetrician gynecologist. He qualified with a Bachelor of Medicine and Bachelor of Surgery and Masters of Medicine in Obstetrics and Gynecology from University of Nairobi. He holds a PhD from the PhD in Epidemiology from Kenyatta University. And before becoming a lecturer over 10 years ago, he had worked in several counties across the country as a medical officer as well as a consultant. He has taught many undergraduate students and mentored many cadres of health and supervised 3 PhD students over 10-year master students to completion. He currently has several other students at various stages of their studies, both at master's and at PhD level. He has published over 20 papers in peer-reviewed journals. His drive and passion are mentoring students and health workers to be able to give quality maternal and child health care in order to bridge the disparity in maternal, neonatal, and child health in the less developed countries. So indeed, it's a big honor to have a professor taking us through the session this evening. So karibu, Professor Wanyoro. We are waiting to learn from you.
Thank you, Dr. Mwembia, you have for the kind introduction. I think I'll just go straight to sharing. So I hope this my slide is, you can see my slide?
Yes, we can see it.
Good. Thank you again, colleagues, for the invitation. I feel honored to participate in this great skills development in obstetrics and gynecology. So today we are going to move from what we have been going through. I know we have done a lot of clinical cases and clinical presentations, which have been very interesting. But we want to move a little bit to basics of clinical research so that we can understand how whatever we apply in our day-to-day clinical work, how it comes about and how it is developed. So this is the outline of my presentation. I'll go through a definition of research so that we understand what exactly research is, how we classify various types of research, and go through how to develop a proposal for funding. So the aim of this lecture basically is that by the end of it all, you will be able to define what research is and list the various types of research. At the same time, you will be able to list the components of a good research proposal. And hopefully by the end of the day, you'll be able to formulate some research questions and specific objectives given a specific case scenario. So I want us, as we go on with this lecture, to think about this case where you have noted an increase in the number of women coming to your hospital with the septic incomplete abortion. You know, this is one of the problems that we have in many of the hospitals. And of course, we know it's a major cause of maternal morbidity and mortalities. So you have noted this, many women coming to your hospitals with this complication of abortion. And what you want to do is to conduct a study so that you can be able to determine their demographic characteristics, as well as the socio-cultural factors that determine the septic abortions in your area. So what I would want us at the end of the day is to be able to formulate 3 specific research questions, which will be answered by 3 specific objectives. And then we would hope that you will be able to indicate the type of research that you would be able to conduct so that you will be able to answer the questions in as far as the issue of increased septic incomplete abortion is concerned. So basically what is research is, it basically refers to search of knowledge. So you are going further when you are doing research. You are going further to look for knowledge so that you can be able to understand various conceptual things that may happen in your area. But further to search of knowledge, research is basically a systematic scientific way where you seek specific information on a defined topic. So like for our case, you are looking at issues to do with incomplete, septic incomplete abortion. So that is a specific topic that you will be interested in. And then you'll go to the field and do a systematic search for information that will lead to answers to the specific problem of incomplete septic abortion. So what you do is that when you are doing research, you only achieve to answer the questions through an objective analysis of the data that you'll collect. And after you collect the data, you will be able to answer the initial specific questions that you had come up with. And so that at the end of the day, you will be able to fill a knowledge gap, that a gap that you did not have, you will be able to fill it. So there are various ways that you can seek for knowledge. And traditionally, we have sought for knowledge from 3 things. That is seeking from authorities. So we have people who we can say that this is an authority in a certain field, or in our customs and traditions. So there is a lot of knowledge that we can get from customs for what has always been done. So you can go back and learn and be able to answer some questions from the customs as well as the tradition. Then, of course, we can also search for knowledge from personal experience. So there are some people who have had a lot of experience in a certain area. Say, for example, if you are looking at septic incomplete abortion in, let's say, Kiambu County, you have gynecologists who have been there for the last maybe 20 years, and they can tell you from the knowledge that they have gained from the personal experience they have had throughout their working career, then this is probably likely the social demographic characteristics of these women. Then, of course, you can also do reasoning, which we are going to see. It is more scientific, or you can do a purely scientific inquiry. So for reasoning, you look at it in 2 ways. You can have deductive reasoning or inductive reasoning. And deductive reasoning is basically where you start from a general theory, then you proceed to a specific application. A good example is like we know that when dark clouds are seen, they are basically associated with the rains. So if today the sky has dark clouds, you can assume that it is going to rain. So you are doing logical type of thinking where you are proceeding from a general assumption that dark clouds are associated with rains, though you have not done any study to determine this. And since you have seen dark clouds, then it is likely to rain. In the inductive sort of reasoning, this is where now you move from specific observations to make a general statement. So if you are using inductive type of reasoning, in as far as dark clouds are concerned, then you will observe for some time. And from those observations, you can say that every time that there are dark clouds in the sky, then it rains. So you have a specific thing because you have been looking at dark clouds over time. So then if today there are dark clouds, then it is likely that it is going to rain. So you have moved from specific to a general statement. Now, let us look at the types of research. And I'm sure many of us know basic type of research and versus applied research. So in basic research, this is where you find scientists or people developing and testing theories that are basically challenging to the researcher. A good maybe example would be looking at maybe you look at the size of a hair from women who develop or who have had something like preeclampsia. So you say that this is quite challenging, and you want to test a theory that maybe their hair is thin or thicker. This may not have any application at the moment or even in the future, but to a researcher, it is intellectually challenging. Of course, basic or pure research, the opposite of pure research is applied research. And applied research is basically done to solve a specific problem, either for policy formulation or for understanding a specific situation or for clinical improvement. So for our case study, you can see that we have a specific problem, and the problem is incomplete septic abortion. And you want to understand how come women are currently coming to the wards with septic incomplete abortion. So that is a specific clinical problem. And you want to have to generate data that will be able to bring in issues of policy, issues of clinical improvement, so that such women do not, you reduce the number of women coming with septic incomplete abortion. And for those who come, you will be able to understand their sociocultural context as such that you can be able to prevent these women coming from the villages with incomplete septic abortion. So you can also have primary or secondary type of research. And when you look at primary or secondary type of research, the main thing you are looking at is the data sources. Where are you getting the information? So data basically is the information that you gather to answer specific questions. So if you are going to the field to gather the information, get data on various variables, then you can call that primary research. So if you are looking at already data that has been gathered by other people, like you are doing, you are looking at published articles, you are looking at patients' records, and gathering that data, generating that data, or making that data into, or putting it into a way that it can answer your questions without going to the field, then this is called secondary type of research. So the main advantage of going to the field is that it gives you conclusive results and you are in control of the data. So you can be able to reduce the bias. But on the other side, primary research is time consuming and it is usually costly because you need many data and you also need a lot of time so that you can get enough of your, you can be able to get enough of the sample of the population that you want. But for secondary data, because it is basically desk review, so you can collect like 1,000 files from the records, and then you sit in an office and you are able to organize the data there. Then this is usually cheaper and it is easy to access. But remember, for you as a researcher, you don't have the control over the quality of data, because we know that in many of those records that we have, in many of the files that we have in our hospitals, they don't have complete data. So the issue of incomplete data is a major problem with secondary type of research. Of course, you also don't own the data because you are not the one who collected this data. And there is also a lot of bias that can come about. And then, of course, it is not time bound. Then the other types of research, or the other type, or the other way to describe research is whether it is descriptive or analytical. So for descriptive type of data, you want to describe the state of affairs as they exist without making any correlations or evaluating the data critically. So mainly this type of research, you go to the field and you do a cross-section. So you just want to go and at a specific time point, you collect the data and you move out. So this type of research will only be able to, you'll only be able to get numbers. You'll only be able to also get percentages and frequencies. So like for our case, if we are to do descriptive type of research, then you can be able to go to the wards and you just get the ages of these women, the education levels, the number of babies that they have had before, the number of miscarriages they have had before. So you'll be able to say that maybe 10 out of 100% of 100 women who come with septic incomplete miscarriages have had one previous normal delivery. But when you want to do analytical type of research, you want now to use more of facts. Okay, so you will gather primary data or secondary data, and you do analytical type of data evaluation. This will allow you to be able to draw conclusions such that you can be able to say that the women who come with the septic incomplete abortion, their education is, or septic incomplete abortion is related to the educational level or positively influenced by the income that these persons or patients have in their household. So analytical type of research is more informative, and you can be able to draw correlations, and you can be able to make hypotheses to inform policy. So, of course, when you look at the research, we say that you must collect information, and the information that you collect, we call it data. And we have two main types of data. So we have the qualitative type of data, which is basically descriptive sort of data. So a good example is like a person's name, like John, Mary, Simon, etc. That is qualitative data. Or the colors, because you cannot put a number to a color. So you can say this color is green, this color is black, this color is brown, etc., without being able to put numerical value to that character or that data. On the other side, we can also have quantitative type of data. Quantitative type of data is numerical data, the data that you can be able to count, like the scores in an exam, how many people, how many people achieved 85 and above, the weight of oranges, okay, and also the sizes, the different sizes of people. So this type of data is usually called quantitative, because you can be able to put a numeric figure on that data. So basically, if you look at qualitative type of data, it is usually, it explores in human research, it's supposed to explore human behavior, their preferences, their gender roles, their cultural expectations, etc. So basically, it is type of research that answers why people do things the way they do. Okay. So it discovers their motives and desires as well as attitude. For this type of data, you normally do interviews. So you do things we call in-depth interviews. So you gather people, 10 or 15 people, then you do in-depth interview, or you can go to key people in a hospital, and then you can get key informant interviews. This data is usually in a form of text. So you go and tape the persons as they give you the information or as they talk. Or you can be able to take to write. So it is basically textual in manner. Qualitative type of research has many strengths because it is said to be very robust. The information is very detailed, and it puts the socio-cultural as well as the human voice to context. So you can be able to explore many issues that are related to the human behavior when you look at qualitative research. The information, of course, is diverse, and data can be collected with fewer resources because you don't need a very big group of people to saturate your data. Of course, it has some weaknesses because in some situations, you may want to objectively verify the data. So you may want, so for something like for quantitative data, another person can go back to the field and be able to verify this data objectively. Of course, also the analysis, because you have to put the analysis into different themes. The analysis is more difficult, and you also need more skilled data collectors so that you can have consistency when you are doing qualitative type of research. Qualitative type of quantities, it is much easier to calculate a sample size, and you can be able to do statistical analysis on the data, and this is the type of data that can be applied. This is normally the data that you see in maybe pie charts, tables, so you can see the number that answered specific questions and how they answered those specific questions. So, but what we mean with quantitative data is that you want to have a representative sample. So you must sample size, and you also calculate the P so that you can be able to power your study appropriately. So it has a number of strengths and of course weaknesses. So one of the strengths is that the data you get is numeric, so it is countable, and you can be able to analyze this data using simple statistical methods. The data is also verifiable, unlike in qualitative type of research, and it can be compared between different populations as well as different localities. However, quantitative data may also, if we are not very careful, especially when we are collecting the data, you may have some data gaps. And this is more so when you are collecting secondary data. It is easier when you are collecting primary data because you can be able, at the end of the evening or at the end of the day, you can be able to go back, or you can look at your questionnaires and you are able to pick the gaps in the data, and you can be able to fill that gap as soon as you are able to get your participants. Then, of course, the data collection is also quite tedious and it takes a lot of time. So you need more manpower, and you also, of course, it needs more resources to do a quantitative type of study. So to bridge the weaknesses and also to strengthen the strengths of qualitative and quantitative type of research, then you can also do a mixed type of study where you use qualitative methods to answer the things like the social aspects, and use the quantitative type of approach so that you can be able to collect and now numeric data. Of course, when you do a mixed method type of study, it is more holistic, and it allows something we call triangulation, so that you can be able to put depth to the type of conclusions that you make, moving from a very narrow point of view to a more type of but one of the weaknesses is that you may get perspectives, especially the deep perspective that we gain from qualitative data, that may be at conflict with get in the quantitative type research. So in your interpretation, you can harmonize the two, especially when you are doing the triangulation, so that you don't have a lot of confusion with your interpretation and your conclusions. So having gone through the type of research and the type of data that we collect, then we can look at what is a good proposal. So, of course, a proposal is where you normally start with. So for our case study, where you are looking at septic incomplete abortion, you need to have a well-structured way of answering your questions. So this should address a clear and current need, like we have said, of septic incomplete abortion. So you should also have a clear background so that you identify a research gap, because you may think that it is a problem, but when you go to literature, you find that already the reasons for septic or incomplete abortion are unknown. So you go and look at what have other people done, what is the knowledge that exists, so that you can be able to identify a research gap that you can be able to fill with your research questions, with your hypotheses and focused objectives. Then, and a critical area when you are doing a proposal is that you should have a clear methodology, and we'll see why you should have a clear methodology. How are you going to collect data? Among us two, are you going to collect data? What would be your sample size? How are you going to analyze your data, etc.? And how will you present this data? Then we should also have a clearly defined outcome measure. So what outcomes will you observe, and how will you determine that these outcomes are important or not important? Then also you must have a way of presenting your results, how you interpret those results, and how the results will be utilized for improvement of clinical care if we are looking at research for clinical care. then all research should be ethical. We should not aim that we all fulfill ethics when we are doing research, especially among us patients, because remember, the primary reason that patients came to us is actually for treatment. So doing research on them is, despite the fact that we know that this research may help in future patients or management of patients in the future, it may not be interpreted at that point that it is going to help that patient. So we must do no harm to the patients as we do the research. And a good proposal will have a very good ethical question. Then the research should also be fundable. We should ensure that as we write a proposal, our aim should be that these proposals are fundable. We don't want to write proposals that are just frustrating and we don't get funding from them. So the research should be in a way that people who can fund the research will find it interesting to fund that research. Now, let's look at the background, because the background is very important. Background is usually called the literature review. You are looking at what exists as of the moment, and it mainly helps us to identify the gaps that we want to fill in when we are doing our research. It helps us to decide the type of research we are going to do, whether it is analytical or whether it is basic research, what type of data we are going to take, etc. And then a good background will also help you to formulate the research questions and also the specific objectives, as well as decide on the methods that you are going to employ to do the research. Basically, it is based on what exists. So you can look at the experience of people. What have they been experiencing before? You can do desktop literature review from written articles, etc. However, when we are doing background research, we should, as much as possible, try to be as comprehensive and exhaustive as possible. Now, then after you do your background, then you identify the research gap that you want to fill. So you come up with research questions. And for research questions, they should be very clear. They should be well focused and concise, and the questions should be researchable. So if we look at our example of noticing that there is increase in septic abortion. So one of the questions that you'd probably ask is, what are the socio-demographic characteristics of women admitted with septic abortion in selected hospitals, maybe within Kiambu County. So you can see that such question is very clear, and we know that what we want to do is to look at the socio-demographic characteristic, and it is very concise and it is researchable. The other question that we can raise is to determine the socio, or what are the socio-demographic determinants or socio-cultural determinants of septic abortions. So if you look at socio-cultural determinants, then you will go now to qualitative type of research. So you want to know the culturalization of these women. Does it have any determination in them arriving with septic abortion? So their background, their upbringing, their religious belief, do they have any role in these women coming with septic abortion in your hospital? Then, of course, the other researchable question maybe for such women would be what are the outcomes of women who are admitted with septic abortion in selected. So like this one, you can see that you do quantitative data. So you want to know out of so many women who have been admitted with septic incomplete abortion, how many have gone home? How many did we need to remove their uterus because they were too septic? How many women died? Out of these women who went home, how many have secondary infertility and how many do not have? So here we are actually looking at numeric data, and we see the type of research that we will do. Then in your proposal, you should also have a broad objective. And normally broad objective is only one, and it is related to the core problem that you are looking at. It shows the type of population you want to work in and the place. And normally you use a verb. So in our case, if you look at these patients, you can say that my broad objective would be to determine the factors associated with increased septic abortion. So you are looking at many things. So it is broad enough so that you can be able to come up with specific objectives. So you can say that it is related to the problem, septic abortion, which is the topic of the study. It shows the target population. The target population is women admitted in selected hospitals, okay? And then you want to determine the factors. So it is broad enough. Then, of course, you go to specific objectives, and specific objective will describe the variables that you want to evaluate. In a good proposal, we don't expect more than 4 specific objectives, and they should be SMART. SMART means that they are specific, they are measurable, they are achievable, they are realistic, and they have a time frame. So when we look at our case scenario, one of the specific objectives, looking at our questions, would be to determine the socio-demographic characteristics of women admitted with septic abortions in selected hospitals in Kiambu County. But then it must be time-bound. So which period do you want to look at this? From January to December 2021 or 2022. So you can see it's very specific and it is measurable. So you can measure socio-demographic characteristics. Then 2, you can evaluate socio-cultural determinants of septic incomplete abortion. Specific, what are the socio-cultural determinants? So evaluate them. Look at the socio-cultural things and see whether they are related or they determine the septic incomplete abortion. Among which population? Women admitted in selected hospitals in Kiambu County. That is the place. Then the third one is to establish the outcome of these women admitted with septic abortion in these hospitals within a specific time frame. So you can see that I've tried to raise these questions which have been answered by 3 specific objectives. Now, the other thing is that we have said is that when you are writing a proposal, it should address a current need. For us, our current need case scenario is septic, the increased number of women coming with septic incomplete abortion. So you must have a problem statement when you are writing your proposals so that you can be able to answer the question, what is the problem? Is it the burden of the disease? Is it that there is emerging illnesses like what we are having currently with COVID-19? Or is it that there is a change in the pattern in the presentation of a disease, that we were having few septic abortions in the last few years, but now we have seen an increase? So that is the what. the problem statement that answers the question what. Then you must justify your proposals. So justification looks at why. Why do the study? Because you don't just do the study for the sake of it. So you want to generate data, either data does not exist from your background review. You also want to create policy briefs. So you want to brief the county policy at the policy level so that you can inform policy to change in the management of patients with septic abortion, or you can inform policy so that we can change the sociocultural beliefs of women so that they don't delay so much when they develop an abortion. Or you can just justify your research so that you can be able to justify to reduce the morbidities and the mortalities that is associated with septic incomplete abortion. So basically, the justification answers the question why. So the methodology is the most critical. So this basically is how you will be able to achieve your objectives. And it should be, you should be able to give concise information that can be reproduced. So, and if another person comes to your area of study and employs the same methods that you described, that they will be able to either come up with a similar result or understand the content of your result. So that is why research methods is very critical. So for our case study, as we have said, we can do mixed method, or you can do basically quantitative, descriptive, cross-sectional. So you just go, every woman who comes with septic incomplete abortion, you take their data, okay, without analyzing that data other than putting them in percentage numbers and percentages. Or you can quantitatively analyze this data so that you can be able to say that their income is related, or their educational level has a relationship with septic incomplete abortion, etc. So the methodology basically explains the type of study that you want to do. So what type of study are you going to do? Are you going to do a mixed method? Is it a qualitative? Is it a quantitative type of study? Okay, is it analytical type of study, or is it a descriptive type of study? Then in your methodology, you should tell us the study population. For our case is women admitted in gynae ward in a specific location, which hypothetically I've said Kiambu County. Then what sample are you going to collect? What will be a sample size? So that if you are doing an analytical type of research, then you can power your study enough. Then which methods are you going to sample? Are you going to do a census where you take all women who come with septic incomplete abortion, or are you going to randomly select a few? And then you should define how are you going to randomize that, or those women, so that the few that you are going to take are representative of the whole population of women with septic incomplete abortion. Then describe the methods of data collection. Are you going to do questionnaires? Okay, are they going to be self-filled, or are you going to use some data clerk to fill those questionnaires, and the type of analysis? Then please, in human research, don't forget the ethical consideration. How are you going to ensure that the consent is given to participate, and the women or understand why they are participating? Okay, how are you going to ensure their data does not move to other people? Okay, so there are a lot of things that you must consider in ethical consideration. And if a person refuses to participate in your research, am I going to be denied the care that is due to me, etc. So then, of course, we must have a timeline to achieve our study, because you don't have all the time to do your study. So you need to have a timeline. And in the timeline, what we normally look at is the time you take to develop your proposal. It may be 1 to 2 months. Then the time you'll take for data collection, the time you need to process your data and interpret it, then the time for writing your report. Then always remember that you need to disseminate. For any research to make any sense, you need to go back to where you collected the data and disseminate this result so that it can improve care of the patient. Then, of course, all research should be achievable and fundable. Look at the teams that you have and the resources that are available. Sometimes we may think that whatever problem we have is very important. But remember, being important may not always be achievable. So you must consider what you are able to do at your level, at your various level. What are you able to achieve so that you can be able to achieve it within the timelines that you have given yourself, and also with the resources that you have. And in research, especially when you are writing research that you want to be funded by other people, it is better to underpromise than to be promise but overachieve. Then people will be happy with you, rather than overpromise, then you don't achieve and you have already spent funds. So in summary, what I would say is that research is basically a systematic and objective way of investigating various theories and hypotheses so that we can be able to generate knowledge. And as we have seen, there are several research methods that exist depending on what you want to investigate and what your question is. And when you are doing a research, you need to have clear objective, and then you also need to decide the type of data that you are going to collect and also the timeline. And a clear proposal is key, and it must be highlighted in all its key components. Thank you.
Okay. Thank you so much, Professor, for breaking it down very well. I know research is not a cup of tea for so many of us, but you have really simplified the topic. I see we have a few questions. Kindly allow me to read them for you. And we have Brian Chelugui asking, what is the difference between sociocultural and socio-demographic? And then his second question is, must the study be specific to the research question only?
Well, socio-demographic is usually things like age, parity, education levels. So that is more numerical data that you can collect. But sociocultural, you are looking at the cultural perspective of specific phenomenon that exists within a geographical area. So you are looking at issues of culturalization, issues of how culture defines gender roles, etc. So it is more of how, answering the how. How do people feel about different things? How do cultures take this and that? So it is very different, because when in socio-demographic, you can do quantitative type of research. But when you are looking at cultural issues, you look at more of the qualitative type of research. So must research, or the second question was about?
Must the study be specific to the research questions only?
Yes, when you are doing a research, the first thing is that you start with a research question. And the research question, for any research question, normally you have a specific objective. So you go to the field, and when you have written your proposal, remember, you have to be funded, or to fund it if you are funding it. So to be able to answer to a specific inquiry, which we are talking about a specific objective. You also go through ethical review, so that you can be able, and ethical review will be looked at in the lens of what you want to do. However, when you go to the field, you may collect data that will generate more research questions. But for further research questions that you generate, then this may need a different type of proposal, a different approach, and more funding. So it is always good to limit your study to the objectives that you set to do. Then after you finish your study, then you can be able to raise further questions that can be funded in the future.
Okay, I hope that's clear, Brian. Then the second question is from Geresia. What's the difference between research questions and objectives?
Well, a question is basically a question, okay? And the question is not measurable. So it just raises, a query, like what, it answers the what, like what is, if you look at the heights of pupils in class 8, what are the heights of pupils in class 8? So that is a query. But as an objective is how you will be able to answer that query. So for an objective, you now set a method that will be able to answer your question. So you will now go and determine, so measure the various heights of pupils in class 8 and put them, categorize them in different heights, okay? And then you'll be able to determine what are the various heights according, like, let's say, to the age of these pupils, or according to the weights of these pupils. Yes.
Okay, thank you. Then the other question is, does the number of specific objectives, this means that the number of specific objectives should always be the same as the number of research questions? Do they have to be the same, the specific objectives and research questions?
Yes. For a good proposal, you actually limit the number. If you have 3 specific questions, then you should not have more than 3 specific objectives, because you don't leave an objective hanging without a specific objective, without a way of how that question will be answered. So every specific objective aims to answer a question that you had raised, or a query that had been raised. So they should be the same in number.
Okay, then Joan is asking, what's the difference between research proposal and the research problem?
The proposal, thank you, Joan. That's a good question. As we have said, a research proposal is the whole process from doing your background, so that from realizing the question, then doing a background of that problem. Okay, then after you do a background of the problem, you realize that there are some gaps that exist in knowledge. And then you want to do now to raise some questions related to the gaps that exist in that knowledge, and raise specific objectives to be able to answer those questions. Then have a methodology which will clearly define how you will be able to gather information amongst who in the field, and how you will handle that information, how you will present that information, etc. A research question basically is just a part of the research protocol. A research question answers the question what? What is the problem we want to research on? So what is the problem we want to research on, and what is the problem within the specific area that we want to research in? So for example, we know that, as the case I had put, there is septic abortion in all counties. If we are writing a general proposal, somebody will ask us, what is the problem with septic abortion in Murang'a County that we want now to research on, to do a research in Murang'a County and not in any other county within the country? Is it that we have seen a lot of morbidity or maternal mortality within Murang'a County that we want now to go and do the research there? So a research question just answered the what is the problem and what is the problem within your study area.
Okay, thank you. There's another question from Geresia. What methods are used in testing the hypothesis?
Hypothesis, mainly you take descriptive data. Mainly it is for, you use descriptive data, so you collect numerical data, and then mainly you do statistical analysis. The type of statistical analysis we do is inferential statistical analysis, where you can infer or where you can make conclusions from comparing different variables or different things that you had gone to look at. They are called variables. So you can infer and say A determines B. So you must have numerical data to be able to prove a hypothesis. So you start with a hypothesis, which is a general statement, but you want to go now to the field and see does your general statement start when you take data and you do inferential statistics.
Okay, I see we still have a number of questions. Maybe let me pick two. One from Barasa Wekesa to comment on the role of mixed methods design in the medical field, and two, the available opportunities for proposal submission.
Okay, thank you, Baraza. So what is the role of mixed method? Mixed method is a new field in medical research, or relatively new. It's not so new, but it is quite robust because of something we call triangulation. Triangulation is that you want to get the in-depth of various phenomena that occur in medical field without making narrow conclusions. So in most of the times nowadays, what we are encouraging is that you try to use both methods, use a mixed method of study, so so that you can do an analysis, and you can also do thematic analysis of data. Then you triangulate the two so that you are able to understand more of the background, usually the socio-cultural background of various phenomena that occur. A good example is we have introduced the concept of facility deliveries, okay, and move from women from home delivery to facility delivery. But in some areas, you find that the women are still delivering at home. But you want to understand why you want to answer the question, why are they still delivering at home? What are the socio-cultural factors that may lead to women avoiding going to deliver in hospitals? And there are many socio-cultural factors that may make women still deliver in their homes, etc. Of course, the other good area that we can apply mixed method is in understanding why things like FGM still occurs, despite the knowledge that we have, or despite the laws that we have made, the government has made. How come it still occurs? So what are the sociocultural issues that determine the occurrence of FGM in some areas and it doesn't determine in some other areas? So it is rich, it is applicable in health. So what are the funding opportunities? Well, there are many funding opportunities, and it all depends on the questions. Remember, there are many funders, there are many people who want to fund research, but unfortunately, in most of the funders also have their own intentions. So they have their own agenda. So if you look at people like Bill and Melinda Gates Foundation, it funds a lot of work in the medical field, but they also have their own themes. This year, they may want to fund research on determinants of preterm labor or preterm births. Next year, they may want to fund research on HIV in maybe a selected group of people. So funding is available, but of course, we have to look for it, and we have to also adjust to the funders' intentions without, of course, harming our population. Thank you.
Okay, thank you. We are out of time, but let me take one last question from Anthony Mwangi. Please advise on the proposal ethical approval in the counties and interior regions. Do we have the ethics approval committees?
Okay, thank you, namesake. Ethical approval committees have been decentralized. Initially, approvals used to happen centrally in Kenyatta, Kemri, UON Ethical Review Committee, which of course used to take a lot of time. So when the National Council of Science and Research and Science and Research came on board, it tried to decentralize ethical review to various areas, and it mandated specific institutions to be able to do ethical review and give ethical review certificates. So most of the universities that have that do human research, whether it is medical, whether it's social sciences, etc., they have ethical review committees. So we have ethical review like in the KU, we have in JQuat, MKU, those are the areas around here. Then we have in Egerton, we have in Moi, we have in this university in Kisumu. So most universities of higher learning have ethical review committees that have people who have already been trained, and these committees have been given mandate by NACOSTI to do ethical reviews and give ethical review certificates. Of course, all ethical review committees charge a fee to do the ethical review. They also demand that When you do the research, you deposit a copy of your results with them, which is usually not done. After you get an ethical review, you should go to NACOSTI and you get a certificate to be able, or an authorization to be able to go to the field. Then when you go to the field, of course, you have to be authorized by the local research team to do the research, but they don't do ethical review at the local, at the hospital. But there's a team that authorizes you to do the research at that level. Then, of course, when you are doing the research, then you must have a written consent from the participants. I hope that answers Anthony.
Okay, so thank you so much, Professor, for taking your time and for being so patient with the mini questions. From the chat, clearly people are happy. The responses are good. They've enjoyed the presentation and they've learned a lot. Thank you. So we've come to the end of our presentation for this evening, and this was our 8th presentation out of 12. So we have 12 more to go. Next week, we'll have a session on maternal collapse and neonatal and newborn care and neonatal resuscitation. So unless there's a word from any of the Equalize team members, I think we'll close the session.
Great. Thank you, Professor Wanyoro. I think it seemed to be very helpful, not just for the doctors, but also for me here to understand more about research today. Thank you so much, everyone. Meet you all next Monday now. Have a good night.
Good night.
Good night, everyone.